I want to talk to you about breast implant revision. Not all breast augmentation surgery is a woman's first set of implants. So there are a number of reasons why a woman would come back for revision of her implants. The first one is for a size change. I'm happy to say that doesn't happen for us very often because I think we have a very good system to help you pick the right size implants. And then I always say, it's okay that women come back and say, I could have, would have, or should have gone bigger. Because if it were different, that half said I'm too big and half said I'm too small, those half that are too big are like, oh, I spent all this money on my implants and I'm embarrassed by them. So we don't have that many occurrences of size change, but it does happen. Generally, it's not the same year where someone feels like they made the wrong choice. It's generally years later, and their bodies have changed and styles have changed, and it's time for an implant exchange. So a size change is one reason. When someone decides to go smaller, or if in the time frame from getting their implants to the day of the consultation, their weight has changed a lot, whether that's weight gain and loss or babies, they might need a lift. So part of a conversation regarding an implant exchange might be, I'd like to have new implants. Do I need to do anything else? In other words, do I need a breast lift? Parenthetically, I always say it really should be called a nipple lift because it doesn't do what a bra does, but it does bring the nipple back up closer to the position that we consider normal. The second reason that someone could have a need for a revision of their breast surgery is called a capsular contracture. The body naturally makes an envelope of scar tissue around the implant. It does that around anything artificial in the body. Most things that we put in the body the shape can't be changed by the scar tissue. But a breast implant starts out like this, and then if the scar tissue says, oh, there's something foreign there, I need to wall it off, it turns it into a sphere. And then that doesn't look or feel as nice as it used to. And if it doesn't happen equally on both sides, now they don't match. A third reason that someone can come in and have a consultation regarding revising their implants can be that they would like to remove them. That's occasionally because they feel that their implants are making them sick. And that's a conversation that we can have. I think it's not really a cause and effect, but I'm happy to have the conversation. But if you feel that your implants are making you sick, and if a conversation isn't consoling or reassuring, then sometimes the right answer is to take them out. See if you feel better. And then you're free to put them back in if you so desire. Doesn't have to be a final decision. A lot of women that I see are switching their implants from saline to silicone. There was a time period where we didn't have as much access to silicone implants, and saline was commonly used. And those women now have had their implants for years, they've had kids, the skin has stretched, and they're ready for a new set of implants. Silicone is much softer, it's much closer to what the body is like. It behaves a lot better than saline. And so most women who have saline implants will someday come back and exchange them for silicone. One of the hard things when someone already has implants is to say, well, I want to make a size change, how do I do that? The beauty of having saline implants is that with verification that they're saline, your card, a mammogram, the operative report, with verification that they're saline, we can deflate those implants right in the office, and over a couple of days you go back to just you, and then you can say, okay, well, I don't need implants anymore, or I do want an implant, and now I can try them on and make a decision about what size implant now fits my body. It can be a short time frame of deflate the implants, give it a week, pick new implants and have surgery in a week or two, or it can be live with it for a while, and then when you finally decide what you want to do, then we can take out that empty deflated implant. Those are all examples of reasons why a woman would come back and have a conversation about my implants are older, or I'm not as happy as I once was, and we can discuss what the options are. We'd like to help you get your ideal result.